Imagine sitting in a classroom and being unable to understand anything that the teacher is saying, or being laughed at because you thought the teacher said celery when in reality she had said salary, or going to a sporting event and being unable to distinguish any of the sounds because it all just sounds like a big blob to you. Unfortunately, this is reality for many students struggling with auditory processing disorder, otherwise known as APD. While APD does have symptoms similar to ADHD and autism, according to the American Speech Language Hearing Association, APD is an auditory deficit that is not the result of other higher order cognitive, language, or related disorders. Not only does auditory processing disorder affect the student's hearing ability, but it can also affect reading comprehension and cause language deficits. To put it simply, APD describes how the central nervous system uses auditory information. However, auditory processing disorder does not show up on any hearing loss tests. Essentially, when the student hears something, the brain receives the information either distorted or it's missing segments, sort of like a short circuit. Now, some of the symptoms in ADHD and autism are similar to the symptoms of auditory processing disorder. These symptoms may include difficulty processing information, easy distraction from background noise, asking for things to be repeated often, and difficulty staying focused. However, the primary difference between these other disorders and APD is their actual neural processing of auditory input in the CNS is intact, according to the American Speech Language Hearing Association. Attention deficits in these other disorders are what's causing the impediment in their hearing. However, an APD deals strictly with auditory dysfunction. As a result, auditory processing disorder can be very difficult to diagnose. According to the Journal of the American Academy of Audiology, in order to properly diagnose a child with APD, he should go through a series of behavioral checklists to evaluate both behavioral and physiologic functions. In fact, a test was done for students having either ADHD or APD. Children with APD were viewed as having a deficit in attending to auditory language stimuli and processing auditory information, and as being at risk for academic and language deficits, according to this particular study. The multidisciplinary team is another great approach. By having students evaluated by a psychologist, speech-language pathologist, and teacher, the team can help narrow down the diagnosis. However, the actual diagnosis of APD must be made by an audiologist. Now, you may be wondering, what do I do if I have a student with APD in my classroom? Well, the first thing to remember is that there is no cure-all treatment for students struggling with APD. However, there are a few ways that we can help attend to their needs. According to the article, How to Help Student with Auditory Processing Disorder, one way that we can do that is by compensatory strategies. These cues, such as nonverbal cues, cues such as gestures, body language, can help clarify what you're trying to say to the student. Making sure you have the student's full attention when talking and directly facing them can help eliminate them always asking questions. Secondly, improving the learning environment. You can do this by helping reduce the background noise to make it more clear, speaking closely to the student, and speaking at a comfortable volume without yelling. Finally, skill-building strategies help to improve students that are struggling with APD. Computer programs such as Fast Forward were designed specifically for students struggling with language and auditory disorders. One-on-one therapy may be necessary for students who are severely affected by auditory processing disorder. Dr. Bellis of the American Speech Language Hearing Association states, the type, frequency, and intensity of therapy, like all aspects of APD intervention, should be highly individualized and programmed for the specific type of auditory disorder that is present. So while some students may improve as they grow older, some students will always have a deficit. In conclusion, auditory processing disorder can significantly affect a student's learning abilities and comprehension. While research is still being done to better understand APD, we can still help our students who have a successful school career. As Ignacio Estrada said, if a child can't learn the way we teach, maybe we should teach the way they learn. I present you all with this question. We've discussed students who are misdiagnosed with ADHD or autism when in reality they have APD. However, how would you approach a student who's been misdiagnosed with APD when in reality their hearing impediments are the result of something much larger, such as a disability like autism or ADHD. Thank you guys for listening.